Well, hello, everybody. I want to introduce someone who's very special, near and dear to my heart, a colleague and a friend. This is Dr. Kim Carpenter. Thank you for being here with us today, Doc.
Absolutely. Thanks for having me.
So the purpose of doing this interview is to spread light, hope, inspiration, and provide value to both your patients and my community as well. And so you are the very first of a series of interviews we're going to be doing in the upcoming weeks here. And before we get started, I'd love for you to introduce who you are, where you practice, what your purpose is, how we met. Why don't you tell us a little bit about yourself?
Thanks for having me, Larry. So I'm Kim Carpenter, and I'm a chiropractor in Louisville, Kentucky. And I actually I've been in practice for about 16 years. And when I started my career, I actually started working with Dr. Larry, which is awesome. And so we were young out of school and associates, and we learned a ton together and grew together and have always had a passion for empowering our communities. And it's what we both do today. And you know, personally, my passion is, and my purpose is to give and to love and to serve. And I do it every single day, sometimes in my office and sometimes out of my office. And every day, if I can wake up and know that I've left the world a little better than how I found it that day, then that's an awesome day. And so that's what I look for every day, is how to make the world better. And I do that through, obviously, chiropractic care, which is a phenomenal way to make the world better and to empower people to live their best life. And I do that every day with my family and my friends and my community. And so it's an honor to be with you here today, Larry.
It's an honor to have you here. And yeah, we were young chiropractors one day, and to watch you grow and develop. And I'm always so inspired to hear when I hear you speak. And I already did a 45-minute presentation that I recorded and gave out to my community. So they've heard my perspective, my tips, my information. And what's amazing is you're going to give a totally different angle. And so one of the things that you and I both have in common is we sort of break the wellness up into a triune of eat well, move well, and think well. Mm-hmm. So I want to give people value and tips that they can put into action right now in their household. So if we could break it up into those three categories, I'd love to hear what your thoughts are, no pun intended, on think well.
Yeah. So to me, the foundation of everything is your nervous system. You've got to have a healthy spine and nervous system for the body to function at its optimal potential. And then it's what you feed it, from the way you think and the way you eat and the way you move and the way you care for yourself and your environment. It matters so very much to what your resistance is like and to your resilience is like. And really, for thinking well, you know, there's a lot of pieces to it. But to me, thinking well beyond the nervous system is the next foundation that's critical. I believe that the entire way that you live is a reflection of your self-esteem and your purpose with how you want to show up in the world. And there are action steps we can take around that, you know, for every single one of us, every single day, especially this time in our lives, and in the timing of the world. How we show up in the way that we think matters more than ever. And our communities need us, our families need us, and we need ourselves to be as strong and resilient as possible. And it comes to me with being patient with yourself. How you react to these situations is the most critical thing. We can't control everything in our environment right now, but we can control how we react and respond to it. And I believe that there are some tips that I do every single day. I practice affirmations. I've always done affirmations. I think, you know, since I was 9 and went to Zig Ziglar, I started affirmations. And they are the foundation for pulling me out of things like fear or grief or loss, which for so many of us right now, we feel absorbed by that. But when I do healthy, thoughtful affirmations that are personal to me, it brings me back to the moment of what's real. And really, for most of us, life that we're fearing or grieving has either already happened or it's going to potentially happen. But in the reality, the only thing that's real is right now I'm on a Zoom call with you. And that's what's real. And that's amazing. And it's wonderful. And it's full of joy. And there's a lot of gratitude in it. So I truly believe that staying in the moment and getting your mind clear on the affirmations that are real to you can pull you out of fear and grief. And then it allows you to serve at a higher level. The other piece to that is visualizations. I don't just visualize what I want the world to look like in 30, 60, 90 days. I also visualize what I want my day to look like today. I know that today I want it full of joy and laughter around my kids and doing things like this for my community. And when I can do that and visualize what I want the world to look like, I automatically take steps towards what I want versus fear or grief, which is what I really don't want in my life right now. And then the third piece for me, and that I work with my practice members, is just gratitude. We have an abundance of things and ideas and perspectives to be grateful for. And the moment I can sit with gratitude, fear and grief become quiet and they dissipate. And I know that every single day I have a tremendous amount of good in my life, and there's a tremendous amount of good in the world. So if you want to think well, take the action of detaching from what is fear-based or grief-based and attach into gratitude. And then the world really does expand in really good ways for you. And you start to not only feel good, but your nervous system works better. And then you do start to think better. And then you do become a part of the solution for us moving past this stage in our world. And I think it's critical right now more than ever to instill those habits in yourself and in your family.
Wow. I mean, there is so much there. We could speak an hour just on those things, but in summary, it was being present, being where you're at with whom you're at in the moment. And there's a great book on that written by Eckhart Tolle called The Power of Now. Fantastic audiobook or book to read. Then Dr. Kim talked about setting aside a time of your day to do affirmations, positive statements of what you want to occur, and visualizations. And then, of course, living in a state of gratitude. You know, are you going to be a hope spreader or a fear spreader at this time? And I hope that we all become hope spreaders. So let's move forward. Thank you for that. That was thorough. The next part of this would be to move well. And so what would you teach? What are you teaching your practice about moving well while they're at home?
Well, for our practice members, we do have a 6-week program that they can follow online that we give them access to videos and to exercises to really help with flexibility and core strength and stability. And those things are critical. And I do believe that every day we can look for ways to move. I don't care if it's a kickball game with your kids. I don't care if it's a long walk or a long hike, as long as you're monitoring and doing social distancing like it's recommended. And for me, I move daily. I saw your post the other day. I love to use the Peloton app. When I'm at home, it's a great way to work out. I love the Orange Theory things that are on YouTube. There's a million videos right now that you can access, but commit to moving. It is amazing for a lot of us, me included, that when I move, that's when I become the most grateful. It's when I actually come up with the best ideas of how to give, love, and serve. And it allows me to, when I'm moving, to have thoughts move through me, not necessarily controlled thoughts where I'm in a control state. And I just think it's so critical, and I know it's so critical that we build strength in this time. You know, movement is a big piece of chronic disease, which we all want to be part of the solution on that, right? So we want to move and stay strong, stay stable, and stay flexible because we need that for resilience in our communities. But with the moving piece, I love doing things indoors. I love doing classes, and I'm going to those all the time when we're not social distancing. But I believe also moving in nature is critical. And I believe that when you can get in the world and you can hear the plants rustle and you can hear the birds sing and you can be just move, but then present in nature, it taps into a part of your brain that absolutely needs to be tapped into regularly for you to be healthy. So moving outdoors is critical for your health. And then really focusing on that indoor like training mechanism is critical too. But both of those, if you can commit to that every day, even if it's raining, can you get outside and be part of nature to realize that the world is really so big and not so scary?
That's awesome. And yeah, I heard someone say, and so I'm not going to take credit for it. If right now, if you just watch the birds flying, they have no clue of what's going on with this coronavirus. And just be like the birds right now. Just move out there in nature, and they're totally unaffected by it. So great tips. We got to get moving to stay well and be part of the solution for ourselves and for our communities. It's unbelievable now how our health doesn't just impact us, it impacts everybody. Your ability to stay well now keeps other people healthy and safe. It's incredible how interconnected we all are, as separate as we are right now. Last piece, and again, you and I could do a weekend seminar on eating well, but the chemistry of our body is going to play a large role. And I know it's a little more complex than just eating your fruits and veggies, but let's give some people some tips. What are you teaching?
Yep. Obviously, we could go into a complete, workshop on this piece, but let's just keep it simple so that you can take an action step today and not have to redo maybe everything. I'll tell you the two main little tips that I do every day. If you simply goal to eat, let's just say 5 to 7 fruits and vegetables every day, just commit to that. Then automatically you're fueling your body with a variety of different nutrients that you need to heal well, to stay well, to repair well, and to really get your mindset around the idea that food is fuel. Food is how your body repairs. It's the fuel it needs for you to give and to love and to serve. It's your fuel. So if you can commit to just 5 to 7 fruits and vegetables per day, you're automatically moving closer into a wellness state. And the other piece for me is, because I believe mindset and food are so intricately connected for people, and definitely within our society, that so many people do emotionally eat out of grief or fear or trying to feel joy. But to really recognize that food is fuel. So I love to ask myself a few questions before I eat something. And I love to ask myself, does this food fuel my life? Does it fuel my life and what I want my life to look like? And if so, yes, I can eat it. And if it doesn't fuel my life, I'm going to leave that to the side. Does it fuel my relationships with my family? And for me, does this food fuel the relationships that I have to make them stronger and more joyful and more purpose-driven? Great, then I can eat that. And does this food help me to feel good about myself and the world that I live in? See, emotional eating all too often leads us then into this state of guilt or negative self-talk. The fuel that I eat can fuel my life. So if you can answer yes to the question that does this fuel my life, please enjoy it and eat it, because it's fueling your body for being part of the solution. It's fueling your body and your nervous system so that when we come out of this, you're healthier than when we went into this. And I believe that's our duty to our families, to our society, and mostly to ourselves, to really empower our body and fuel our body in the best way possible. So even just separating from is this food good? Is this nutrient driven? Does it fuel your life? And if so, then load your plate with it. And if it doesn't, then set it to the side and decide that you're worth a new normal for yourself.
I am smiling on the inside and the outside. You are such a gem. So think of food as your fuel, not your therapist.
There you go.
and you know what? You could put a sign on your refrigerator and it just says, it's not in here. It's not in there. It's in here.
Yep.
It's in here. So Dr. Kim, thank you so much for spending time with us today. What a gift to your community in Louisville and ours. Our wish is that everybody in your community is staying healthy and well right now. As we part here, do you have one word of hope, inspiration during this time for people? A quote, something positive?
The biggest thing that I would say is look for how you can give, love, and serve in your own life and with your family and with your community every single day. And if you can do that, then on the other side of this, it turns out to be a huge blessing because the world became more love-driven. And I think that is powerful.
Wonderful. Thank you so much again for your time. And I wish you a very great day and lots of health and happiness down there in Kentucky.
Thanks, Dr. Larry.
All
See
right.
you soon. Bye.